Have so many awesome guests that you book. If you will, introduce your guest.
Sure. Our guest today is Dr. Mark Saracino, a chiropractic neurologist in the King of Prussia area. Dr. Saracino's skills go beyond the typical chiropractic treatment that we're all familiar with. I'm going to ask the doctor now to tell us a little bit about himself, his practice, and how chiropractic neurology can benefit injured workers.
Thank you, Sonny, and hello, Joe. How are you? Thank
Great,
you for having me on your show.
Welcome aboard.
Chiropractic neurology is a rare and exclusive subspecialization within chiropractic. I was one of the first 5 in Pennsylvania. It requires 3 years additional training in the functions of the brain and nervous system like a medical neurologist, but we have our conservative bent, more or less. I work with a lot of neck and low back pain patients like regular doctors of chiropractic, but also children with ADD and migraine headaches and pain that radiates into the arms and legs, abdominal, ophthalmic, migraines, and concussion. A lot of people suffer from concussion, and a lot of people are much more aware that concussion exists, which is great because we adults who might have suffered concussion in our younger years and didn't get the right treatment would now be suffering from that, or many times are suffering from that.
What I find amazing about, we're talking about the concussion discussion, it's amazing because all the young, when we were young, played high school sports. I remember, I played running back. I remember definitely twice in my life where I got a concussion. Any other time that I may have felt that way, you just blow it off. But I remember my senior year, we were playing Monsignor Biner at Roxborough High School, and I got hit on the side. And I remember going back to the huddle, telling the quarterback, "Don't give me the ball, because I don't know where the hell I'm at."
Right.
The interesting thing was, I never came out of the game, and it kind of cleared up. And then one time when I was playing flag ball, I got rolled by about 4 guys, and I remember remembering that feeling where I was totally not there, and it was like the first game of the year, and so I went down really hard, and I woke up. I knew I blacked out for at least a minute, and I was sure my buddies were going to be all coming over to see how I was. And when I cleared up, I saw them all drinking beer at halftime about a mile away, not real concerned about me, right? But the point I'm making is, back in the day, it was one of those things you had. Now you got people my age, and who from the era where they didn't pay attention to concussions, and you're dealing with the after effects of that.
No doubt. And you don't have to lose consciousness to have a concussion.
That's a huge misnomer. People, tend to believe that you need to lose consciousness in order to suffer a concussion, and you don't.
Right. There used to be a protocol where you had to lose consciousness and you had to see white spots in one field of vision, like in the upper left or the upper right field of vision, or you had to have prodrome, which is a strange sensation that's hard to describe. It has a vague description that one experiences before the onset of the headache, and you had to have nausea. So those 5 previous protocols are no longer even included.
Right. I never had the nausea, and if I blacked out for a second. In other words, I wasn't out. And one of the things I find amazing, because we're both. Sonny's a big baseball guy, and I'm a big football guy, and we talk sports a lot. But what I find amazing is I'm fascinated about the concussion topic, because the concussions that I had, and a lot, and it causes me to, when I'm watching, say, a pro game or something, or maybe a college game, one of the misnomers is it has to be a crack, like they have to bang heads like rams. And the truth of the matter is, my concussion hit right off the side of my head. Like, in other words, it was a side of the helmet type of thing, where it wasn't a total roll. Yeah. I didn't fall on the back of my head.
More of a graze.
Exactly. And you see a lot of concussions like that, where somebody gets kicked in the side of the helmet or something like that.
It's true. And in boxing, I work with some boxers and professional boxers in Philadelphia, one of whom may vie for the world championship for the welterweight division May 1st in Washington, Julian Williams, and he allowed me to speak about my relationship with him professionally.
Great.
But in boxing, and I'm not so sure about all the rules, but you can hit a boxer on the side of the head, but not the back side corner of the head. And there are benefits to not doing that for the health and safety of the boxer. But getting back to the discussion,
which typically isn't the opponent's biggest concern while he's in there.
That's right.
So it could happen anytime and
And sometimes you see a boxer throw a wild punch, a looping punch to the outside, and it gets the guy in the temple or the girl, whereby the shots to the jaw hitting the boxer on the button, it used to be called.
Yeah.
There's about 2 inches to either side of the jaw. There's a little hole where the mandibular nerve comes out. That is the button. And when you hit that, it kind of paralyzes temporarily the jaw muscles, so the jaw moves back, then the head whips, and then you get the ensuing concussion as a result. But I noticed in boxing, just to stay on that subject, that boxers don't seem to go for the button anymore. Because when you miss it, you really miss it, because the hand grazes off the head, and the head is always moving. So, but to your point, Joe, and were you a fullback?
It's funny. I was actually a halfback, and if you saw my brother, he's about 160 pounds. He was 195 and jacked when he was younger. Now he does yoga, and he was a middle linebacker and center, and I was a halfback. Believe it or not, I know. Most people think I had to be a lineman or something.
Right.
But Doc, I'm still quick, man. They say never give up on your dream. So every year at the NFL draft, I'm eligible, man.
Yeah.
I'm getting past the age limit, I know. But yeah, no, and I wasn't the fastest guy, so my dad always used to say, deliver the hit,
right.
And so that's what I would do.
Right.
And I coached high school football for about 8 years total, and I would always profess, try to get the goal is 5 yards. You know what I mean? You're not always going to get 5, but the point is, you get the 5, everything else is gravy.
Right, yeah.
You run hard and whatever, but in my case, the 5 yards, that was like, that was my average. I can't tell you how many times I got caught, but I got hit a lot, and but I always try to deliver the hit. And I remember ringing my bell, but I remember, that back then the concussions were, they were just. I don't even think we came out of practice. A couple times, whatever. But it's you're dealing with a lot of these pro athletes. Is there any? Can you ever see? And look, you look at these NFL players, man. And they're just they are lethal weapons. 6'2", 245 linebacker, 4'6", 40. Legit, right there. He's getting, there's a second round draft choice.
Right.
Okay, 6'4", 255 linebacker, 4'5", 40. That guy hits you.
Yeah. Big bodies, a lot of force.
Oh my God. And so, Doc, do you ever see us being able to make the game safer, and or if not the game, being able to, lessen the effects of the concussions?
Yes, and I think the helmet technology is improving, and the defenseless receiver being hit.
Yeah.
And, when you're a safety or a linebacker, we just love it when a man is half tackled and you can just plow into him, and I think those days are over. Dropping the head isn't good because it straightens the curve in your neck, so there's no torsional ability for the neck to absorb impact. Now, bike riders are always have their head arched back because they're in that position. So in that case, it's often held too much. I often recommend that patients sleep on a cervical pillow, which is like an orthopedically designed pillow. It's essentially a pillow with a hole in the middle, but it's more than that. And what it does is when you lie on your back, it helps to maintain the forward arc in the neck. The arc of the neck should be forward. That's the normal architecture of the bones there, as well as the low back. Like sitting on a chair that doesn't have the right backrest support, the curve flattens, and if you slouch, then it reverses, which is very bad.
Yeah.
Because the nerve roots that exit the neck and the low back go right through those big muscles, which are in the back of the neck.
It's interesting because I have arthritis in my neck, as you could probably imagine, because that's how I hit. I'm delivering the hit. Okay, and
I think that's how we were all taught. When we first played football.
Yeah,
put your head down and.
What I always taught the kids was, and when I taught the kids, make sure you can see where you're hitting. That's where if you can't see where you're hitting, that's where your neck is vulnerable, and you're in trouble. But sometimes, and my neck, literally speaking, it controls a lot of my life in the areas if I don't get a good night's sleep. And by the way, I don't get a good night's sleep half the week. And so because of the arthritis in the neck, but sometimes I can't find the right pillow. Sometimes I have a pile of pillows next to my bed, and including some arthritic. I was always wondering if there's muscle memory. I'm not joking when I say it.
Oh, absolutely. Now, for example, in the car, when we have low back pain, our car lordotic curve, the forward curve in the low back normally feels good and most car seats are now designed well ergonometrically that we sit in our car, the low back forms to that forward curve, but yet when we have low back pain, the back seat doesn't, the backrest of the seat doesn't feel good anymore because the low back curve is flattened.
Right.
Same thing with you. Certain days when your neck is in spasm, the curve changes.
I switch pillows I'll switch pillows to and I'm constantly doing it. Right. I mean, I got 2 light ones today. I'm not joking. And literally speaking, the throbbing in my neck is something that has been, but if I get a good night's sleep, and sometimes when I do get that, it's worth its weight in gold.
Right. Gale Sayers used to lower his shoulder and accelerate right before impact, which I think is wise, because if you have more inertia going forward, the impact to the body is less than if you receive it. Also in football, and I coach the Marple Newtown High School varsity football team as a volunteer line coach. We're now all taught in Pennsylvania, well, coaches of all sports have to learn the concussion protocol and bullying and hazardous abuse, hazardous materials, things. We all have to get these credits online, but the concussion protocol is good because it's a beginning. And when we were in high school, we were taught to bull the neck back and to block with the nose, because you want to be halfway inside the person's body. Because if you shoot for a shoulder, you can miss that person, whether you're
get position,
trying to block or tackle them. So that aspect, the horse collars, I think, need to be developed more. And they are the pads around the neck that go atop the shoulders, the shoulder blades, and the aspect of arching the neck back and keeping it arched back. The emphasis isn't to preserve the curve in the neck, which I mentioned earlier, but it's to lock and contact the back of the helmet to the top of the shoulder pad. So if your neck is arched back, you feel that locking, and then your head is connected. So any force generated to the face or to the forehead transmits through the helmet into the back of the helmet onto the shoulder blades, so onto the shoulder pad, so that there's less force onto the neck. But whereby today they don't teach that. They teach everything away from the head, but you see more dislocated shoulders and missed tackles and missed blocks. And what we see, and we're of a certain generation of poor technique on the football field. But that raises the athleticism of the players. So we can get into this discussion of how sports have evolved over time. But look how athletic the defensive linemen are in high school, and their arm work.
Right, and the funny thing is this: even with baseball, for example, yes, there's less. And it's a funny thing when you go see a professional game, a Major League Baseball game, an NFL game. Yes, there's less kids playing the sports than there used to be because there's so many other things to do. But the athletes that are playing the game and the development of the ones that are playing, Sonny,
concussions are just as real and just as dangerous in baseball as they are in football. Perfect example, Brian Roberts, second baseman for the Baltimore Orioles.
Sure.
A concussion ended his career, and he had a great career. But he was chasing after a fly ball, ran into another player, suffered a concussion, and he was never right after that.
When we come back after the break, we'll talk a little bit about the treatments that you offer and a lot of the really, really interesting technologies that are out today. We'll have more from the Sonny Banks Show after the break.
My friends, this is Joe Kraus. You've heard me on Philadelphia radio now for over 20 years, and you know I don't often endorse products or people unless they are real game changers. I want to tell you about Weinerman Pain and Wellness, located in Center City, Philadelphia. And at the end of this short personal endorsement, I want you to consider Weinerman Pain and Wellness. If you are recovering from an injury, if you or a family member has been diagnosed with a disorder that has stopped you in your tracks, or if you're like me, determined to learn about wellness while getting yourself prepared to stay healthy so you can enjoy the blessings of your family. Remember the name of this warm and caring location, Weinerman Pain and Wellness. Why should you consider Weinerman Pain and Wellness? Because they are who you expect them to be.
Weinerman Pain and Wellness, located at 100 South Broad Street, just south of City Hall. Call Weinerman Pain and Wellness at 215-988-9503. That's 215-988-9503. Call today.
It's Thursday night, and you're grabbing drinks with some friends. Started off with a pitcher for the table, which quickly becomes 2. There's pool. And there's the photo booth.
All right, everybody squeeze in. Say cheese!
Followed naturally by an order of wings. And another.
Can we get some extra ranch sauce?
Then there's the ceremonial nightcap.
So what are we doing this weekend?
And lastly, it's back to the car, which, if you're buzzed, could be the most expensive night of your life. Getting pulled over for buzz driving could cost you around $10,000 in fines, legal fees, and increased insurance rates. Nothing kills a buzz like getting pulled over for buzz driving, because buzz driving is drunk driving. Brought to you by the National Highway Traffic Safety Administration and the Ad Council.
My name is Sue Smith. I'm 38 years old, and I work at a graphic design company. Which is funny, because I couldn't even draw a stick figure when I was a kid. But I met someone who told me, you know what? You can do anything if you really want to. And if the teenage me were here, she'd tell you,
I wouldn't be into drawing and art if it wasn't for big brothers, big sisters. Most kids from my neighborhood don't get into art. They get into trouble. But I was lucky because my big sister showed me early on that I didn't have to be like most people. And to the young me,
that meant a lot. My big sister's name is Sheila, and Sheila is the reason that this 8-year-old grows up to have an amazing job as a graphic designer.
Whether you donate money or time, you're helping Big Brothers Big Sisters help a child, and that can last a lifetime. Start something today at bigbrothersbigsisters.org. Brought to you by Big Brothers Big Sisters and the Ad Council.
They just told us right away that we're going to house you, we're going to feed you, and every single one of his medical bills is just all taken care of.
They've saved my family from financial ruin. It allowed me and my wife both to focus on the most important thing, which was the health and well-being of our son.
We have phenomenal research, outstanding clinical care, and the generosity of public, which allow us to treat patients regardless of what it takes. And that's what makes St. Jude so magical.
At St. Jude Children's Research Hospital, families never receive a bill for treatment, travel, housing, or food, because the only thing a family should worry about is helping their child live.
Doctors send us the toughest cases to be treated at St. Jude, and our patients come from all over the world.
When we come here, they told me, don't worry, everything's being taken care of.
We could never repay St. Jude for what they've given us.
Because of you.
Gracias a ti.
Because of you, there is St. Jude.
All right, welcome back to the Sonny Banks Show, sponsored by Weineman Pain and Wellness, serious doctors for serious injuries. I'm your co-host, Joe Doherty. We're having a conversation with chiropractic neurologist Dr. Mark Saracino. Doc, you know, and I say this all the time, that sometimes the conversation during the breaks is, you know, just as fascinating as the on-air conversation. Let's talk about the after effects of the concussion. Sonny, you deal with a lot. Yeah,
I think I said when we were off air that one of the biggest problems that I have from an injured worker standpoint is proving that the injured worker actually suffered a concussion, because the symptoms oftentimes aren't noticeable. And I think that the adjuster or panel doctor thinks that the injured worker is faking. So what protocols do you follow to make sure that that is the proper diagnosis and that you're treating it correctly?
One of the first treatises with concussion is that it comes from trauma to the brain, inflammation to the brain. Concussions become worse 6 to 9 weeks after the impact. Worse. It gets worse over time. Then it peaks for about 1 to 2 to 3 months, and then it starts to diminish on its own without the right therapy. So that's same thing with a fracture of the foot. The compartments in the foot are so tightly bound, the capsules, that if you have a fracture of the foot, you really shouldn't get it x-rayed right away. You should wait 5 days so that any small fracture that's there would become revealed when you apply ice, compress, and elevate the foot, as an example. But it's particularly difficult for workers' compensation experts and attorneys like yourself and doctors to come to that basic. That's one of the first things we learned about concussion, and we still know that it peaks 6 to 9 weeks after the impact.
And it's weird because the protocol in sports is, you know, if you're not having a headache or whatever they have, I don't know the protocol, but if you meet the protocol within, 2 days, you're able to play the next week.
Right.
So the ankle, when you sprain an ankle, it swells and it hurts. You sprain a knee, it doesn't swell so much, but it causes weakness in the quadricep. You're walking and your leg kind of gives out. In the low back, you sprain your back or hurt your back. There's swelling, but it's very deep, but there's mostly muscle spasm. So that's how the body reacts to trauma in those 3 body parts, just as an example. Ankle swells and pains, knee creates weakness, low back goes into spasm. In the brain, if the whole brain is swollen and 30% of that swelling goes away after a few weeks without any treatment, if the deepest components of the brain don't drain, then the shrinking outside parts will add more pressure to those areas. Like, for example, an arborist will tell you, it's not the rainfall and the wind during the storm. It's a few days later when the earth starts to dry that cracks form in the soil. That's when the soil starts to get smaller and pull away and create cracks. Then if you have a windstorm 3 days after the storm, the rainstorm, that's when the tree is most likely to topple. So if you have swelling, let's say you had swelling on all of your brain from a concussion, and that's ideologic. That's really not how it works, because we don't get hit in one particular place and it causes swelling throughout. It causes swelling 180 degrees on the other side. So if you hit your forehead, it's the back of the brain that bounces up against the back of the skull, and that's where most of the swelling is.
So what specific signs or symptoms are you looking for in order to make the diagnosis of a concussion?
Convergence is the ability to focus our eyes toward one another so we can determine its depth. That's important. Optokinetic testing, which is what I do in my office, which allows the doctor or the practitioner to look for things called pursuits and saccades, the ability of the eye to get back to center when it's not really looking at anything. And then visual evoked potentials are things that, it's like a Dave & Buster's goggles that you put on, and you're asked to look at if it's a green fluorescent ball or an orange fluorescent ball, and it moves in a sinusoidal 90-degree angle type pattern. You can measure how much overshoot your eyes have when it changes direction, and how slow it may be to follow that ball if it's going up in a certain direction. Now, if you can imagine having these goggles on and watching that ball moving slowly, your eyes will probably be able to follow it well, regardless of how severe your concussion. But if you move at a reasonable rate, you'll be able to follow that much better. There's a little bit of overshoot because you wouldn't know when the ball is going to make a 90-degree turn up, down, or off to an angle. That's one of the other ways. Visual evoked potentials. Ophthalmic neurologists do those tests, this pursuits and saccades. It's kind of like the knee-jerk reflex of the eye. When we're driving down the street, we see a sign, our eyes evert, our head turns, our trunk rotates, but we come back to center. The ability of the eyes to come back to center so that we can maintain our balance if we're riding a bike or walking or driving a car is just as important as all the other visual things that we think about. Visual field, what we can see.
So those are the things that when somebody, if you want to check somebody for a concussion,
yes,
and Sonny's representing a
yes,
client, those are some of the things that, but it's such a specialized field.
Well, in addition to a referral to a medical neurologist who is sympathetic to patients who have concussions and who have a lot of skill with it, if that doctor comes to the same conclusion that I come to, that a concussion occurred, and more doctors are using concussion as a diagnosis. And it's nice that we're all together in this regard. We know a lot more now about concussions than we did 15 years ago.
Yeah, I had no idea that visual cues, played such an important part in making the diagnosis. And it sounds like it does.
Other more gross things are, biting your tongue, slurred speech, of course, drooping of the face, sensation that when you're getting dry, coming out of the shower, if you feel sensation different in one arm versus another, lightheadedness, dizziness. Sometimes a condition called orthostatic hypotension, when you stand up quickly and you feel lightheaded. This sometimes happens at night when we have to go to the bathroom, or first thing when we wake up in the morning. If we arise out of bed quickly, the blood doesn't get to the head quick enough because the baroreceptors in the carotid arteries don't tell the.
But when you're giving somebody a test, and that's when, especially when you're representing somebody, the eye tests, what do the diagnostics look like? In other words, when you're providing the results of one to an injured worker, because
the neuro-ophthalmologists do a good job of determining that. They don't incorporate chiropractic neurologic technique, which is to try to correct the part of the brain that may be lacking. So if the eye comes back to center when you're driving and you're looking at a sign, then you want to come back to center without getting nauseated doing it, and some people do. Mm-hmm. They can't be a passenger in a seat, or particularly in the back seat because of the vibration from the back seat. We all know about that.
I do.
When you have a concussion, those people suffer the most. Versus nighttime driving versus daytime driving. Nighttime driving is particularly difficult because the fovea centralis of the eye is getting barraged with light. It's like when you go to the theater and the singer is singing and the focus and the spotlight's on her face or his face, you become mesmerized by the lyrics and the music because your brain is kind of like you're being hypnotized, right, because your brain is focused on that one area. Right. But you can't stay there forever because then you'll get nauseated, right, or get sick, and then the lights have to come on in the room. That's why it's important that when you work on a computer screen, the light around the screen is just as bright as the screen itself.
Really?
So watching TV in the dark isn't good because you're bombarding the fovea centralis, the center of the field of vision, more so than the peripheral field of vision.
Can you please tell that to my wife?
Me too.
She's always shutting off the light. I'm like, I need the light to watch TV.
Sonny, I tell you what, I'm like your wife. I'm always in the. Sometimes I'm in the computer, and it's dark in the room, and it just. Although, lately I've had the light on because I guess I try to focus, and I'm always turning the lights off, and. I obviously I'm wrong.
Good pixelation with a computer screen is important. An eye doctor will tell you that there's nearsightedness and farsightedness, and indeed they're right. But there are different other distances. Screen depth, there's reading depth, screen depth, television depth, and then farsightedness. And you may need your reading glasses for your screen, but not necessarily for your TV. Or you may not need your reading glasses for reading. So those are things that we need to be more aware of. Close one eye, open the other eye, and see how your body reacts. So the visual cues are just a tip of the iceberg, which I could talk on for a number of minutes here. But the other thing that is often not emphasized is what happens to the neck. 70% of all headaches come from the neck.
Right, and that's what I wanted to get. I wanted to get in. I know you treat migraines and headaches. Yeah, I can't wait to hear this.
So when the neck is traumatized, 70% of all headaches come from the neck because there's muscle spasm. Over a period of time, the muscles leave their spasm, which is an electronic turning on of the muscle. The muscle's got too much tone. But then adhesions form in the muscle in a similar way to how calcium forms in those periosteal reactions in the calf that I was using as a descriptor. If adhesions form in the muscle, it's called myofascial contracture. The medical world likes to describe it as fibromyalgia. And it occurs a lot in middle-aged women between their shoulder blades for hormonal reasons. But for any injury that's not treated properly, myofascial contracture, muscle, connective tissue gets short. Those contracted tendons, ligaments have to be broken so that the normal range of motion can be restored. Now, they are laid down, the repair fibers and muscles are laid down haphazardly. Some of them are parallel to the longitudinal axis of the muscle. If the muscle goes in one north-south direction, the north-south adhesions are beneficial, but the ones that are off on an angle are the ones that prevent blood from flowing through the area and the muscle to contract in a nice linear fashion as it once did. So the body kind of overreacts. It's like if you have a hole in your drywall and you get a bucket of spackle and throw the bucket of spackle or just throw it, just wing it at the wall, you're going to fill the hole not really that well. But if you just put a little spackle on the spackle knife and press it through the hole, you'll get it all in there, and then an hour later you sand it down and the hole is fixed. So the body sends the whole bucket of spackle to the wall, and there are tangential adhesions that form out of line with the longitudinal axis of the muscle. So the body is hurting itself.
So when you're treating a concussion or head injury or an injured worker with migraines, is the focus of your treatment on the neck?
Initially, yes, it has to be. You can't have a concussion without neck problems, without neck involvement. It's impossible. And that gets the patient to become comfortable with manipulative therapy, not just manipulation of the spine, but the deep tissue work that I'm referring to, and the restoration of the range of motion and the re-strengthening and re-education, and the home use of cold pack therapy, Epsom salt baths, cervical pillows, and the awareness that when you're fatigued, when you have a concussion, you can't work through it. You can't exercise through it. It's not like you're doing rehab on an elbow or a knee or a shoulder. You have to just walk away. I recommend that patients work no more than half days if they're not completely disabled, and that they leave at certain times of the day to measure their fatigue level. Professionals, high-level professionals, stockbrokers, attorneys, and gentlemen like you, Joe, who are very intense with what you do for short periods of time, I recommend nutritional supplementation that helps to replenish the brain's neurotransmitters, choline and inositol. There are various formulas out there. They're not memory brain formulas that you might have heard of on the radio, which have a lot of caffeine in them, which is not good. That's a stimulant. And B-complex vitamins, which is not as bad as caffeine, but the components of the nutritional supplements that I recommend for people who have concussion are nutrients that the brain uses for it to fire and for those neurologic pathways to work. Also, the eyes are very important. I also often recommend nutritional supplementation, which is vitamin A, beta-carotene, and some other particular herbs that are known to strengthen and bolster the eyes and get eye strength back to normal. So all these things have to be taken into consideration.
Because you're a chiropractic neurologist, Are your chiropractic manipulative techniques different from the ones that we're used to with a chiropractor?
Yes. I do a lot of deep soft tissue work to break the tangential adhesions and to restore normal motion. Manipulating a spinal bone is a very powerful technique. Manipulation of the spine with physical therapy is absolutely the most effective way to treat neck and low back pain. That's been a proven fact for decades. But it won't provide a long-term effect until the adhesions and the overall biomechanics of the area have been restored, like using the cervical pillow at night, like having your screen elevated so that the curve in your neck is maintained while you're working.
Right. By the way, it's so interesting you do that. You say that because what I did was my screen is pretty much direct like this, but I had to put my keypad on top of a box because what I was doing was I was looking down and typing. And
straining your neck.
I was straining my neck. Right. And so that has helped me a tremendous amount. I was constantly, what type of tech, when somebody comes in and they have a headache, it was so interesting. So migraine, head pain, tension headaches, and look, by the way, the concussion discussion, as we know, is so prevalent today in athletics, but also Sonny sees it on the job.
Slip and fall accidents, concussions happen.
I had a buddy of mine get hit with it. I'll never forget it. We were working at the Neshaminy Interplex, so it was a while ago. It was 1980, I guess 85 or 83, whatever, in that range. And his name was Dave Hall. I'll never forget it. And a 4x came down and hit him right in the hard hat. And man, I don't know what he went through, but
unfortunately, those hard hats offer very little protection.
Very little. And I had a bus driver call for our injured workers program, and he got hit over the head. Doc, he gets hit over the head. Somebody assaulted him with a metal object. A month later, he blacked out. He needed brain surgery.
Wow.
Okay, but so, Sonny, you have such a burden when you're dealing with representing somebody like that, having the proper testing that's not going to be his word against their word.
Yeah, my most serious concussion case dealt with a client who was walking, in the door of his office building, and it had a magnetic closing device. That device fell and struck him on his head. He was totally disabled from day one, and he still is. And that's how freak the accident was, and how strange it was.
The extent of the treatment that I render is, and you could.
How would you, Doc? How would you prove that? In other words, Sonny's representing somebody. It's. And sometimes, I don't care who you are, if you're a judge or somebody on a jury, if it's never happened to you or a family member and you can't see it.
Yeah, he had no visible signs of an injury, no scarring, no lacerations, nothing.
Sonny, he probably had a periosteal reaction on his skull. And if point pressure was applied to that, it would exacerbate and rekindle the symptoms and almost create like a recurrence with his mind for how it is. Likewise, there are nerves that come up the back of the top of the neck, behind the skull, and go around the ear and then go all the way up to the apex of the head, which is the very top part. Those nerves are probably involved. Well, no doubt. Whenever you have the periosteum pulling away from a bone, it irritates all the other nerves around that area, and the nerves are more.
How do you prove it, Doc? When Sonny sends you somebody like this, and he's got to go to court, and this person obviously has issues.
It often describes itself as an EEG and an EMG, which is what medical neurologists do, nerve conduction studies. They insert needles into the arm and hand, send electrical shocks into the spinal cord, and measure the speed in which the nerve supply goes to the spinal cord and comes back. It should create a sinusoidal type of curve if it was plotted on a graph. And if the top of the curve is biphasic, it's called, where there's like a little wave up there, then we know that where the curve is depressed, those nerves that should be firing faster because their amplitude is higher are slowed. And then EEGs are basically where medical neurologists put electrodes on the brain and measure the electrical current that's kind of circulating around the brain through the skull.
And that could give you enough proof for
yes, but that medical neurologist or a chiropractic neurologist has to believe that could be one of the causative factors. Because if one of the nerves that comes out of the back of the neck that goes to that area where there may be a periosteal reaction, if it's here, they need to put the EEG electrodes right there to measure this and be specific with that nerve's ability to react to the test that you're putting it through.
But you're right. I mean, this particular client's head injury was completely disabling. He couldn't drive. He couldn't stand to be in fluorescent lights. I remember when we took his deposition, he actually had 2 pairs of glasses on because it was so bad, sunglasses. But you know, those kinds of injuries can be hard to prove unless they meet certain symptoms that we're able to establish.
I use deep tissue tools of various sizes and shapes. In particular, if anyone feels the back of their head, they'll feel a little bone that protrudes. In thoroughbred dogs, breeders, I understand, feel that to make sure that that bone protrudes symmetrically, whereby if it doesn't, then there's some type of genetic, not deformity, but imbalance. Therefore, there may be something else in the body. And I'm not a dog breeder, but I understood that that's.
But in people, if it protrudes, does it mean you're normal? Because I'm rock and rolling right here.
No, it means you get superior intelligence.
Yes,
you're a superior human being.
It now explains it. Thank you.
Right. So anyway, right around that area is a particularly well-enriched part of the neck and the skull, and deep tissue tool work is very important in that area. Right below that, where the bone sticks out, is a hollow area, and that's where 2 of those big nerves come out. They go to the top of the head, and those 2 nerves intermingle with the nerve that comes out of the front of the forehead, right above the eyebrow. So you can get neck pain causing eye pain as it goes around the circumference and creates this orbital sensation. So deep tissue work right at that corner and right in that hole, I'm using these layman terms, and right where the bone sticks out is very important. That's more specific, and I hope I'm answering your question.
You are, and I was going to say, a lot of these head or concussion type injuries aren't curable. You can't make them go away, but I assume that you can do things for the patient to make the symptoms less.
Yes, and most places don't render the type of deep tissue therapy that I render and don't really understand the specificity of things. The nutritional supplementation for the eyes is important, and the nutritional supplementation for the brain, but yet high-level professionals who use their brain a lot every day, and I take those supplements every day when I work, are important. We want to make sure that, we don't give ourselves enough credit for mental drain. When we're emotionally drained, if we're hurt, we understand that, we may cry or something like that. And in fact, talking about humanism, right, that would take several shows to talk about how your life has been compromised as a result of this. Joe, you mentioned how on certain days, because of your concussion, because of how your neck is with arthritis, it compromises your ability to function.
Well, it's interesting because I focus a lot. I do a lot of writing, and I can say that when I was younger, so I was an iron worker, a union iron worker that used to work on steel buildings. And I can tell you, I focus on my writing and what I'm doing. I get as drained after, a long, if I'm writing or if I'm putting together a presentation or even a show. And so I can absolutely relate to being after a show, for example, trying to focus on, the conversation that we're having. We're not just, we're preparing for it, but you're thinking also about, we're heavily focused in on it. I can tell you that I need a break before I go to the next thing.
Good point about breaks, and office workers need that as well. It's best to have your computer screen adjacent to a window so that your eyes, instead of converging on a short distance periodically when you gaze out the window, which you don't do it necessarily consciously, but it does happen, the eye conversion mechanism can be relaxed for that moment. Different muscles in the eyes can work, and others that are overworked can relax, and different parts of the brain. Convergence is centered in the Edinger-Westphal nucleus, which is right above the nose, about 3 inches deep, to where about 2 inches above the nose. And likewise, people in office buildings, people that do office work, they often do that anyway. After about 5 or 10 minutes, they get a paper out, or maybe they get up and go to the bathroom or go
just to revitalize themselves.
That's right, and they don't realize that. Now, if they're forced,
enough of a break.
Well, for some folks, but for people with concussions, they have to write their disability. They cannot sit in front of the computer for more than 5 or 10 minutes.
How long can that take? Can that last?
If the patient doesn't get the right treatment for a long time, like years.
What I find amazing about what you just said, and we talk about it a lot, is when Sonny, you're dealing with an injured worker. There's got to be like a catch-22. This individual's got obvious problems, to anybody who really cares about them or spends time trying to figure it out. You're not only fighting for that individual's legal ability to get their benefits, by the way, to get denied and disputed, like it's, it is the job of the insurance provider. But let's not forget, if they don't get the right treatment, what could actually happen to them long term. It's just amazing.
That's why it's so important to make an accurate diagnosis.
And that's why it's so important that a good doctor knows a little bit about the law, and a good attorney knows a little bit about medicine, which Sonny does, to get patients to the right people. Because it could be that the first 3 months, the patient benefited from one type of therapy, and then, not to say that you would be in control of the patient's destiny with their health care, but you would skew them or recommend that they go elsewhere for the second stage of therapy if the first facility cannot provide that.
Right. And taking a break on occasion, to revitalize, what you're trying to do. So I'm involved in the labor movement, and we talk, some people, by the way, some people do not get breaks. I mean, it's not in the state of Pennsylvania, it's not required. So sometimes you're working for long periods of time, and especially if you're working in an office or if you're marketing or something where a creative aspect has to be involved, being able to just, take about 10, 15 minutes. Now, Max wants his theory is, if I come in, I get 1 good hour in, I need that 7 hours to revitalize myself for tomorrow. That's I'm just kidding. But
I assume changing job duties is just as effective as, taking some time off.
Yes, indeed, if the brain isn't used in that way. Remember, if the whole brain swells equally, and it never happens, and then the whole brain swelling reduces, let's say 30% after a few months with not even getting the right treatment, the hope is that the inside components, the inside ventricles they're called, reduce their swelling and drain sooner so that the outside parts can take their time and drain properly. If the outside parts drain too soon, like we talked about the soil that dries after the storm, and then you get cracks in the soil, that's when the tree is more vulnerable to fall over, right? Then you have this drier, less inflamed outside peripheral circumferential part of the brain pushing in on the inside of the brain that has swelling.
Right.
We may remember cartoons where the cartoon character would become angry because he or she or whatever it was saw something. You'd see this red ball form in their head, and then sometimes the red line would move out to the periphery, and then when the red line got to the ears, steam would come out of the ears.
Right.
Well, your ears do get hot when you have a headache, and anger does create a balling up of fluid inside your brain. So you feel this outward push. You feel like there's pressure in your brain when you're upset, when you're angry. And that's why anger is a very bad sensation for anybody, let alone someone who has a concussion.
Yeah.
Or to go through other mood swings, high and low.
Wait a minute, anger's... So I thought if you like it just exploded and you got it out, it's good. It's not good.
Well, getting it out is good, certainly, but not getting it...
I thought I was being productive over the weekend.
Letting it get to that point, right? Where you get so dramatic with it.
Well, yeah, no, I mean, that's an interesting point. Because my wife said to me when I left for North Carolina, she said, this is a fact. Do not take this pillow with you. You're not going to bring it back. And so we had a little argument, right? I said, listen, I'm 54 years old. I know I don't look it, Doc, so, I mean, it's true. My brother, was rushing for us to leave this Airbnb. And it was a little bit of confusion. My nephew brought a pillow. It looked like my pillow in the back. We were rushed. I left that pillow in North Carolina. Wow. I was letting out, and I was yelling at my brother for like 2 hours on and off. As soon as we got home, my wife opened the door. Was it like a 12-hour ride? And it was one of the great reliefs ever. She goes, did you bring the pillow? Like my brother thought I was. And I looked, and I just pointed at him. So I was getting some steam out. I want to know that that was. I tell my wife if I lose it on occasion, I feel good after I do it, but I don't know if I'm hurting myself, and I know I'm sleeping on the couch a lot. That causes other neck problems.
It doesn't help your low back either.
Doc, the concussions we could absolutely go on forever there. I mean, as soon as I looked at this, I'm like, we're not going to get past number one. But the headaches. And the tension headaches and the migraines, diagnosing them, and post concussion are those normal after effects?
Tension cluster headaches are more severe than migraines. Migrainous cephalgia, migraine headaches, is a term that's often too often used. A lot of people say, "Oh, I have migraines." They really don't have migraines. Tension cluster headaches they most often have. because they have muscle spasm of the muscles in the top of the neck, which clamps down on the nerves that go around the ear and back up the skull, that, like I had mentioned earlier, that causes this circumferential eye visualization and overall prodromal constellation of symptoms that is hard to describe. Sometimes it radiates into the arm, sometimes it goes into the face and causes slurring of the speech. So tension cluster headaches are more severe than migraines. Migraines are usually accompanied with or by nausea and visual cues. The white spots, still very beneficial to see white spots in the upper outer fields of vision. Nausea.
How can you tell the difference when somebody comes in and they're in pain? Did it come from different areas of the brain? Or
looking at the eyes, you can see if the eyes are anhydrous, if they're dry. You can see if the eyes aren't able to focus properly. Sometimes you can't do optokinetic testing because they just can't even focus on anything that intense. And it's really not that intense. They can drive and they can function, but it's a challenge. If one part of your brain is pushing the eye away from where it should be, then is it because that it's pulling too hard on one side, or that the inhibition of that movement, the shock absorber on the other side, is too weak? And that's part of the challenge with what part of the brain is working too hard, or is it the opposite part of the brain that's meant to dampen that is not dampening it as much as it should? Now we're getting more specific into various parts of the brain for the optokinetic testing and the various procedures that I render. For example, when you raise your left arm, it's the inside of the left eye that sees the movement of the arm. Your nose blocks the right field of vision a little bit, so you know where your left hand is if you wave it in space out by your side. But it's the inside aspect of your left eye that sees that. If you put a mirror on your head, on your nose, if someone holds the mirror and you raise the eye, you'll see the hand move in the mirror. So now the outside aspect of the left eye is now seeing the movement of the eye. Now, this is like more advanced chiropractic neurologic.
But you see a lot through the eyes.
Yes.
Okay.
Yes. So you can train the part of the brain that's being understimulated through the outside of the field of vision. It's okay to see your left hand move in space from the inside part of the eye, but you want to get the part of the brain that is stimulated when the outside of the eye, the peripheral vision on the outside of the eye is working, and that will see the image in the mirror. So you're bombarding that part of the brain, which could either stimulate that part that may need to be stimulated or help to decrease the inhibition on the other side. So that's just one. I know it's kind of specific to talk that way, but that's what one can do for balancing out how the eyes function. They're not eye exercises. These are direct neurologic pathways to the brain.
And that's exactly what I was going to say. When you're looking at headaches, you're looking, there's got to be a ton of cues coming in. Treatment, yes. Treatment of, for example, by the way, I'm going to miss not having lunch with this guy. Oh, we need to have him on 10 times.
Tons more questions.
Oh, my God.
Back. I'd love to come back. It would be my honor.
Oh, yeah. Believe me, even if we just go to lunch, there's a million questions I have. But the interesting thing is, So now the treatment for a garden variety, and I know there's not, but the difference between the treatment for a migraine and a cluster tension headache.
It always starts in the neck. If I relieve all of the muscle spasm and adhesions and restore the normal biomechanics to the bones in the neck and the ligaments and the tendons, and get the patient to behave well at home with daily living activities, screen height, nutritional components, sleeping on their back with a cervical pillow, that often reduces the headaches and the migraine symptoms substantially.
I'm talking about an acute one, though. Somebody comes in the office.
Well, that's different. And cold packs are very important. They decrease the intensity and the frequency of nerve firing, calms pain. Get the patient in the right position, and to render the treatment that they can tolerate most. When you apply pressure to a point and it causes a pain level of, let's say, 8 on a scale of 1 to 10, that's pretty high.
Yeah.
You could make it worse. In fact, many times I say it's going to get worse before it gets better. If the person is tenacious and they're not afraid of feeling a little bit of pain, if they have an athletic history and they say, "Doc, you just got to get in there and do what you got to do," and they have experience with deep tissue work, I could be more aggressive on the first visit. But at the same time, you don't want to scare folks away because they're not used to hands-on therapy. They're not used to feeling more pain to get rid of pain. That logic just isn't there. Some folks don't even want to be touched, and they're never in doctors of chiropractic offices or in my office. They just want drugs to reduce the symptoms without necessarily getting to the source of the problem.
Got it.
You referred to deep tissue treatment a number of times today. What exactly is that?
It's where pressure is applied with small tools to get into crevices that can't be gotten to with the hands and other physical therapy devices can't approach. It's to get into like the edge of a bone that's arced, that is a very small area that even the tip of the finger couldn't get in, but the tip of the finger could not generate enough force to get to that deep level. When you apply pressure to the neck or any part of the body, you have skin, fat, big muscles on the outside, intermediate sized muscles, and then the small muscles that are right next to the bone. You have to get through all those layers. If it takes a couple of visits to get the big outside muscles to relax, then you'll be more effective with the intermediate muscles, especially in the hip. Big muscles, big layers of fat, even with thin people. And it's often that, you treat the hip, it relaxes the bigger muscles, and then on the next visit or the next week, a different part of the hip feels like it's pained because the bigger brothers were protecting the smaller brothers on the inside.
Does sleep help, Doc? Is sleep a big, when you're dealing with tension? By the way, it's kind of almost a oxymoron because it prevents you from sleeping often. But if you can, I always notice if I get some sleep and I have tension going on.
The quality of sleep, and we know them as power naps.
Right. Power naps are like
laying
priceless.
down for 5 minutes, closing your eyes for 5 minutes after working out, within 3 or 4 hours afterward. Epsom salt baths are very effective. Sometimes in the summer, if we come home from work and we're rushed, just to put cold packs under your armpits calms the body and decreases the pressure.
Doc, if somebody wants to get in touch with you, the contact information.
Yes, I have a website. My last name is spelled Saracino, and my website is drsaracino.com. My first name is Mark. I have a very strong web presence. I'm one of the top 10 doctors rated by ratemds.com. And there are several videos that one can watch that describe concussion and things that I do, along with articles that I've written for Muscle Fitness magazine.
And where's your office located?
In King of Prussia, right next to the Valley Forge Radisson Hotel, which is right next to the Valley Forge Casino, right off of Route 422 at the intersection of 202 Pennsylvania Turnpike and the Schuylkill Expressway.
Sonny, contact information for yourself and the firm.
Sure. Office number 215-561-1000. Our email address is www.bankslaw.com.
And we got about a minute left. Sonny, what type of patients at what point do you send over to the doc?
Definitely injured workers with head injuries, especially ones with head injuries that aren't that obvious to me, but I suspect that they may have sustained a concussion. I'm going to send that injured worker to a doctor like Dr. Saracino to get an accurate diagnosis.
Doc, I can't thank you enough.
My pleasure.
This could go on. I mean, as you well know, I'd love to get my wife over. Really,
You're welcome. It's my pleasure to be here.
Can't wait to have you.
I'd like to come back.
Oh yeah, can't wait to have you on again. And Sonny, another one in the books, and a really tell you one thing. I learned a lot. I'm going to be learning a lot of big words when I'm listening to the podcast. I'm going right home. I'm going to learn more.
I hope they weren't confusing.
Pull out the old dictionary.
No, just fantastic. I want to thank our listeners.
Thank you, Doctor. Appreciate it.
My pleasure. Thank you so much. It was my pleasure to be here. For
listening to the Sonny Bank Show on the American Justice Radio Network, sponsored by Weineman Pain and Wellness, serious doctors for serious injuries. We had a phenomenal show. Dr. Mark Saracino was Sonny's guest. For my man Max right there, Jay in the studio, I'm Joe Dockett, your co-host. We'll talk to you next time.